Hi, everyone. It's a pleasure to join you this afternoon for an awesome presentation today. We're so excited to have you all here. So my name is Anisha Patel. I'm the Director of Community Engaged Research for the Maternal and Child Health Research Institute, and we are so excited to have Dr. Bruce, Dr. Nasr, and then also Dr. Merrell joining us online to talk about standards for qualitative research. This is a topic that has come up time and time again. It's a great approach for understanding more, as you'll hear, about any community needs or issues that you might be able to address through interventions in partnership with them. But also, if you want to understand, how a specific intervention or study is working, it can also provide additional rich data. So you're going to hear all about the basics today. But I do have the pleasure of introducing these three investigators who are very skilled in qualitative research. So first we have Dr. Janine Bruce. She is the Executive Director of the Office of Child Health Equity and a Senior Research Scholar with a focus on addressing health equity for children and families through community engaged research partnerships. In her research, she employs a variety of qualitative and mixed methods. For the past 12 years, she's had the pleasure of co-teaching a very large number of qualitative research courses for both medical and graduate students with Dr. Sylvia Merrell, who's joining us online. So I'll move on to Dr. Sylvia Merrell as well. So she is a research scholar in the Office of Child Health Equity, and her research focuses on centering medical education, cultural humility, and language access issues. She's also taught several courses throughout the School of Medicine on qualitative and mixed methods approaches, and has really focused on designing, analyzing, and disseminating this qualitative research. And last but not least, we have Dr. Annette Nasr. She is a nurse scientist here at Stanford, associate professor in the Department of Pediatrics. Her research focuses on liver transplantation, but she really expands beyond that to help mentor individuals according to needs of Children's Hospital. She also conducts both qualitative and mixed methods research and teaches qualitative research. So we are really, really pleased to have these experts join us today, and they are resources available to you, even after this presentation. But quickly, before we get completely started with the presentation, just have to go through a few housekeeping slides. So second. Okay, so we have an upcoming seminar to kind of piggyback on this one. You've had a series now yesterday, today, and then next week. And that one, again, I'll be joined by Dr. Bruce, and we'll be talking about some just basic principles of getting started with community engaged research. We also will be having a symposium that'll be coming up very soon. So you can probably received all the emails to register. You still have time. It's on October the 19th. And the focus this year will be on climate change, induced change in maternal and child health populations, as well as a huge session on PedsNet. And there'll also be usual groundbreaking research from scientists, as well as a focus on omics and maternal and child health. All right, well, that's it. And we're just going to go ahead and get started. And if you have any questions, you're online, you can please put those in the chat. We'll be checking the chat as well. Thanks, everyone.
Thank you, Anisha. Welcome, everybody. And very excited to be here today and have folks online. And we're trying this hybrid format. So for those of you who are online and have any questions, we're really lucky that Sylvia can answer any supplemental questions that you might have as they arise. But thanks for coming. We're really excited to have this session and wanted to let you know that there are some handouts that you'll have access to that we'll be referring to today during the session. So definitely check those out and use those as a reference after the session. But really what we're focused here today is to really provide a workshop that's going to help you build some language around qualitative research and some standard approaches that you might want to incorporate, particularly into any grant proposals that you might have. We're going to do this by describing some really key elements and standards for reporting qualitative research as it applies to grantsmanship, and even those reviewing qualitative grant proposals. We're going to very specifically talk about this checklist that Dr. Nasr will introduce later and is referenced in one of the handouts, because we want to just give you some really practical skills for how to approach a qualitative research study and proposal. And in doing that, we're going to use a very practical example from the field to just make it a little bit real for everybody. Okay, so why qualitative research methods? I think Dr. Patel mentioned some great ways to incorporate qualitative methods, but sometimes you just really want a deeper understanding of what's happening. What's the phenomenon you're studying? What are the perceptions of the patients or families or clinicians that you're talking to? Sometimes you really feel like to study a problem or understand solutions, you want to give participants the opportunity to really bring a voice to what matters most to them. So really through that lived experience. And then why? There's so many ways that we can enhance what we're doing in the healthcare sector with qualitative methods. And then some of you may be wanting to really refine, design, evaluate an intervention that you're doing. And qualitative methods, again, can really help elucidate some of the barriers and opportunities that patients and families face, and clinicians. So again, bringing it back to this focus on grant applications, as I mentioned, there's this increasing utilization of qualitative methods in the healthcare setting, and there's so many different approaches that you can use to really enhance your qualitative study. But from somebody who may be reviewing a proposal, we really want to see that as you design your study, that you're using the most appropriate methods to really answer that research question. We also want to see that you're applying really rigorous methods to whatever you plan to do, and that whatever you do has enough rigor and importance that it will translate outside of what you're doing here, so the broader literature and research communities. And then we're going to use these standard approaches to designing and reporting qualitative studies to really help you build on best practice techniques that are out there, and that you're going to have a shared language and a really consistent process that applies to the qualitative literature. All right, so that's kind of an introduction. Now we're going to dig into the concrete tips.
Can you hear me okay? Thank you, Janine. Great kickoff. Welcome everyone to this session on qualitative research. It's great to see you all here. And I have to first begin by commending each and every one of you for being here today and trying to better understand qualitative research. We are a very quantitative Stanford University sort of campus, and it's really nice to be able to have this venue that we can discuss qualitative research. And it's been quite a pleasure working with both Janine and Sylvia on this presentation. We have decided to take two articles, the SRQR, the Standard Reporting Qualitative Research article, which is in your handouts and online, as well as an original article, Healthcare and the Adoption Services Experiences of People Who Place Children for Adoption During Adolescence, a qualitative study. We just randomly pretty much took this article as an example of, so we can use that to sort of crosswalk between the SRQR and an article to help you understand the tips and giving examples for each of them. The SRQR article, which is in your handouts, is a 31 or 32, was it 32? It is 21 tips that are, there's a lot of different guidelines and different guidelines. We've chosen this one for the purposes of this course. So the SRQR, the authors have done really a fantastic job at providing a clear and systematic way of reporting qualitative research. And this will be really a nice pathway for you to follow when you're designing your qualitative study. These standards can assist you not only in writing a research proposal, but also helping you in preparing a manuscript for publication and critically appraising qualitative research and synthesizing your research findings. These authors, Bryan et al., have generated a comprehensive list of items that were potentially important in reporting qualitative research. They went through a very rigorous method to come up with this SRQR. And the SRQR is, as I said, a list of 21 items. You'll notice on this handout, we just have 18. Sylvia has done a really nice job at distilling it down to make it a little more simple and straightforward for grant writing. Each of us will be taking one of these bullets from the SRQR and give an example from the Kirkpatrick article to demonstrate how you might want to articulate it in your own proposal. Basically, numbers 5 and 15 will be the ones that we address. So let me move to the first tip. So the first tip of the SRQR element is to define types of qualitative study. You have to be able to articulate what type of method you're going to be using. Now, it could be anything from basic qualitative research, which is fine to do. You could narrow it down to a phenomenological study, a case study, a narrative, ethnographic study, and or a grounded theory study. There's lots of ways you can go about it. But a really important thing to remember is it's not the approach that guides your research. It is your research question. So depending on what your research question is how you decide what method you're going to use. You don't come into a clinical issue or a problem or a phenomenon and say, I want to do a qualitative study. You really want to look at what your research question is and say, how can I best answer it? Is it going to be by quantitative methods or is it going to be by qualitative methods? If you look at the Kirkpatrick article, we don't expect you to know the Kirkpatrick article because you probably have seen it for the first time today. But what we did is Janine and Sylvia and I read through the article and we noticed that Kirkpatrick et al. Defined their type of qualitative study, and we took this word for word from the manuscript. And they said, we chose to use a qualitative methodology for this study because it allows for in-depth and rich narrative exploration of particular topics and understanding heterogeneity of viewpoints and experiences pertaining to a particular issue. So these authors did not decide to do a phenomenological study or an ethnographic study. They decided to make it very broad and just keep it at a qualitative methodology, which some would argue, but is fine for the purposes of the grants that you'll be writing. Some tips is, again, choose a qualitative method that best underpins your research question and develop an argument on why this method is appropriate in understanding your phenomena. Why aren't you doing a survey, right? Why do you want to better understand someone's beliefs or ideas? You have to explain that in your proposal. Right. Next slide. What do I do? Sorry, I'll do it. Thanks. The next tip is from the SRQR, is describing your setting, site, and salient contextual factors. So when you're you have to remember to describe the setting that you're going to be collecting your data in. Is it going to be a clinic? Is it going to be someone's home? Is it going to be at an agreed upon location that's convenient for your participants? So in your proposal, you need to clearly define where are you going to be doing these interviews or observations. So are you going to be doing observations? Are you going to be observing a group of people? That can be qualitative. Are you going to do interviews or focus groups? You have to describe the way in which you're going to conduct your study and how are you going to collect your data. The Kirkpatrick article, taking it verbatim, is they stated this analysis was part of a larger study exploring the experiences of people who were pregnant during adolescence. We included questions about decision-making, about pregnancy, support, and influence on peers and partners, and interactions with healthcare professionals. They actually, I believe, they also said that these were going to be taking place in their clinic. So they did actually state that in the article. All right. The next one. Oh, sure.
So I think Annette did a really nice job trying to kind of lay out kind of the structure for how we looked at this article and tried to pull some real examples. I just want to add that just because we're using this article as an illustrative example doesn't mean it's like the best way to do it, because you could have, I'm going to go back to Annette's last slide, kind of felt like maybe there's a little bit of context missing. And that's really an opportunity as we read these studies and we start to write and design our own studies, is how we can make it really clear to whoever's reading, maybe a reviewer or colleagues, and then ultimately how you disseminate your findings. But the more that you can share about the context in which the data are being collected and from whom they are being collected is really important. So that brings us to our next tip, which is the units of study. So we really, in a qualitative study, we want to know, like, who is going to be kind of your main person? Are they individuals? Is it a type of data? Is it a group? Is it a school? Are you going to be doing some type of a compare and contrast? Are they actually not necessarily going to be individuals? Maybe you're going to incorporate some documents or events, or as Annette said, maybe some observations. Those are going to be your units of study, and you may have multiple units of study. So what Bereknyei said is, we conducted semi-structured telephone interviews with people ages 18 to 35 years who experienced at least one pregnancy before the age of 20 years. And we know that this is an adoption study, and so they are looking for people who may have been in a position to think about giving up a child for adoption. They also included their exclusion criteria, which is just generally people who are not able to exclusively speak English. So some tips for thinking about the units of study are: be as specific as possible as you can with those descriptions of the participants or the group or the sites. Tell us as much as you can, because that's going to give us a real picture. Like, at the end of the day, when we're looking at your data or anticipating the type of data you're going to have, we're going to start to develop a picture of who these participants are, what the data is going to look like. So again, don't forget to include any inclusion or exclusion criteria. Reviewers are definitely going to be looking for that. Any questions about the first few tips that we've covered? Sylvia, are you seeing anything in the chat that you want to bring up? No, okay. This is one of my favorite ones, sample size. I think this is actually one of the most common questions people designing a qualitative study will say is like, how many people should I interview? How many people should be in my focus group? What should my standard or my sample size be? Well, basically what O'Brien says in the SRQR is that one of the important things to talk about, in addition to sample size, is how you're going to sample these individuals. So what type of sampling are you going to use? One of the big concepts in qualitative research is what we call purposeful sampling. We don't really have time to go into all the different sampling types, but there's many, many different types that could really be useful for your study, whether it's maximum variation or something we call snowball sampling. But definitely do a little digging into the research, ask us questions if you're having trouble thinking about what your sampling strategy will be. But that is such a key important part of any good qualitative proposal. So basically what Kirkpatrick has said is participants were recruited using purposeful sampling. And basically they did that through Craigslist, which is a pretty broad group of individuals. They did it also through a national adoption agency. So I'm imagining some type of a listserv, and then a national adoption advocacy organization as well. So they had 3 different ways that they were sampling. I think they could have done a little bit more to describe more specifically where if there were any criteria used within each of those populations. But I mean, they have the basics there. The other thing is, if you have anything that could be somewhat complicated, use a consort diagram. That's something Sylvia and I talk a lot about, is that can really help you flush out what your sampling might look like. And that's literally boxes, arrows, triangles, circles, whatever you want, but it's going to show you who are the people and individuals in your sampling, and it'll also be an indication of how you're going to sample them. Now, some people might have another tip is to note how many people might be in each of these categories. So something I might have wanted to know is this Craigslist. I mean, I don't think they can give us a sample size of how many people might be drawn from this Craigslist, but they might actually have a list of how many people are associated with this adoption agency and so forth. And then lastly, I'm realizing we don't have a tip on sample size. There really sample size there are some standards around it. You want to look at the literature and see what makes sense, but the literature says at least a sample of 12 to 15 can be sufficient. However, depending on the complexity of your sampling, you may want to go beyond that, particularly if you're doing any compare and contrast. All right. Okay, so moving on to data collection methods. What O'Brien says is really important is to make sure that with the type of data that you're collecting, you're going to describe that in detail. So whether you're going to do surveys or interviews or focus groups, we want to hear a lot of the details around how you're going to collect those data. And sometimes you may be using more than one method as well. So there's a lot of specific details that you're going to just want to know as you're developing your study, but are also going to be some key things that a reviewer is going to want to see. We've picked out a few things that we find particularly important. The date ranges of when the data are going to be collected. The process, if you're going to have multiple rounds of data collection, how iterative it might be. Are you going to triangulate your data with multiple data sources, and so on. What Kirkpatrick did is they said, we conducted interviews between November 2020 and April 2021. So they gave us a really detailed range that they use. Interviews were conducted by a married Caucasian female pediatric neurologist. So they're also telling us a little bit more detail in terms of who's going to be collecting the data, which triggers us to think about any power differentials, any potential barriers for people talking to somebody about kind of some pretty sensitive issues. They also tell us how long the interviews were projected to last, around 30 to 60 minutes. They were audio recorded, and then they were professionally transcribed and de-identified. And then of course in your IRB, but then also in any grant proposal, they're going to want to see what type of compensation as well. So these are just a snapshot of some of the details that Kirkpatrick included. You may have more, you may have less, but as much detail as you can provide will be really helpful. And then in terms of tips, what this does is this really provides us with details for how feasible your study might be. You know, if we're seeing that, you know, you have a really tight time period or time frame, or you're going to talk about like, you know, a lot of different issues in only 30 minutes, all of these things are going to trigger potential issues around feasibility that could be tweaked. Also, by, you know, describing all of this, it's really going to help the reviewer, help your team understand how clearly you have defined potentially different types of data collection methods and why potentially this is the best one for you. And then lastly, make sure that, as Kirkpatrick did to some degree, you indicate what other resources are going to contribute to this data collection. So who's going to be involved? They talked about who the neurologist is, but maybe they're going to do, you know, multiple interviews or multiple focus groups. We want to see, is that going to be a team of people? Who's going to be really involved? What materials are going to be necessary? What access? I think this is a really big one, access to participants. That can be really challenging. You may have the best thought out study, but if you're not going to have access at the end of the day, it can be quite challenging. Any questions? I see a couple chats. Sylvia, I don't know if that's you or if others have questions.
It's just me.
Okay. Any questions in this group? All right, now Sylvia is going to talk about data collection instruments.
Yes, thank you so much, everyone, Janine and Annette. So talking today about data collection instruments. As you can see here, we're building your study while we're going through the SRQR elements. And so after we talked about how we're going to access the population and sample them, it's important to know how the instruments are collecting the data information that you're interested in. And so this element requires you to describe the study, which type of collection that you're using. It could be interviews, it could be surveys, it could be other forms of document review or observations, for example. But it's also important to know how the instrument that you're using was generated, created, adapted from other resources. And so identifying what those are and going through a rigorous process of pilot testing how you're collecting the data is extremely important, as well as to describe. So we look at Kirkpatrick here. They describe developing a semi-structured interview guide that was, they utilized domains of interest from prior literature, and they added what those domains of interest are, such as questions about decision-making, support systems, etc. So they briefly go over this process overall, but what they've not shown over here is the specific process they may have undergone to pilot test the instrument to see how well the instrument is collecting the information that they're intending to collect, right? That would be one reason to do a pilot test, is to not only look for the flow of the conversation, but also to identify, am I actually using this data in a way that's helping me answer this research question? So part of the tip for the proposal is to, within the proposal itself, describe the types and domains of interest that you're collecting from each instrument that you're using. So you might be collecting different types of questions in an interview guide versus a survey versus an observation. So it's important to distinguish that so that we can look at that and suggest how it might be done, or if you're able to actually collect that type of information in that instrument. It's also important to describe this process of where the domains of interest and specific questions do come from, and Kirkpatrick addresses some of that. And they also, in the original article, they cite where that information comes from. And so the pilot testing, as I suggested earlier, is extremely important, and it's nice to see that written in the article itself. They may have done it, just may not have included it, and that's a decision that they made. But for a grant application, it would be nice to see how that process is in terms of the pilot testing of that. And we also suggest including supplemental information, and this is true of manuscripts, but also of grants, of the data collection instruments itself. And so that grant reviewers or manuscript reviewers have a better sense of the specifics of the study and the types of questions that are being asked to identify how much of an influence the question itself might have on the data that you might be collecting. Some questions are leading, some questions are closed-ended, and so it's nice to see how well structured those questions might be. And then we're looking at the data analysis. Oh, it went over one. The next SRQR element is the data analysis. So far, all we've gone over is the thought process and the development of this research study with qualitative elements in it, and what goes into that. And what we have here is a key element to describe the process which that you might utilize the data that you have collected and use that data as part of the elucidation of answering your research question overall. So what we're looking for here is a process by which your codes might be generated, a process by which you or your team might be utilizing these codes or developing these codes, making sure that the codes are stable within the environment that you're analyzing the data, and then how you might be generating themes after the coding process itself. So you might have different paradigms or approaches to this process. We have some suggested here. We generally see thematic analysis to develop themes overall, and these are generated from codes. And we also have content analysis, which are frequency counts also of codes, but you might utilize one or both in your approach of your data analysis. And so Kirkpatrick here describes the process by which the preliminary code book was generated, how 2 independent coders reviewed and coded the rest of the transcripts, which software that they utilized. They also do the same process by which they described earlier on who interviewed here in the coding process on who participated in that research element here. And that can give us a sense of where they're coming from, any potential biases that they might bring to the table, and also any sort of insights they might have as well. And then they talk about how they used a consensus-based approach to review and reconcile their coding. So the entirety of their coding was reconciled, and that people they come back with a data set that they feel very stable with. And then subsequently, they go through a secondary analysis process, which is your themes generation, as well as identifying any sort of salient quotes to be utilized for dissemination. And so our tips in this is to really describe this initial codebook development. Is it an inductive approach, which is coming from the data set itself? Is it a deductive approach, which is coming from outside resources or outside theory, or are you using a combined approach? And so it's important to identify how that is generated. Designating how and when the team participates, as shown by Kirkpatrick here. They discuss when people come in and who's involved in the different processes. You might include, for example, a team-based analysis approach as well. And then it's important to note that coding and the subsequent analysis of thematic analysis or content analysis are actually 2 different phases of your analytic process. And so it's important to distinguish the 2. Often people do code so that they're able to see their data from a different viewpoint and a different lens. And then after that point is when they go through this thematic or content analysis process. And then the final element we'll be talking about today is this trustworthiness of the data that you're collecting. And what this is basically a method that is generated or added to your process of data collection, or even how you set up your research study throughout the entirety of it. So you could generate trustworthiness throughout each of the sections that we've talked about so far today, or you can add it subsequently after your analysis process. Some common ones that we include are participant verification or member checking, which is going back to the people who you interviewed or key stakeholders of a similar group of potentially people who were participants, and saying, this is what we had found. Does this resonate? Does this ring true? What would you add or change to based on your own experiences? So there are some processes that you build in potentially after this initial phase was completed. You can do something of triangulation across participants, groups, or see if there's any changes over time. And so this would include making sure that you're having representation between groups of people who you're collecting information from, and being able to see, is this ring true across groups, or are some groups experiencing something different from what another group is experiencing. And then the other thing to look for is something called searching for disconfirming evidence. And this essentially is a way to go back and review your raw data to see if there's any sort of deviation from what you've identified through any theme or domains throughout your research process. And it's a great way to explain contradictory or circumstantial shifts in thinking, especially as often as we all know, data collection might be a long process. So we might be shifting or thinking over time. Now, just to point out here, this was something that was not explicitly stated by Kirkpatrick at all. They may have included steps like this within their research study, but there was no statement saying, for example, we search for disconfirming evidence, or no statement saying we address trustworthiness in this manner, just as a point. And so as you think about building your studies, think about how you might incorporate this participant verification or triangulation or searching for disconfirming evidence in your study. And so we have gone through a few key elements that were suggested by O'Brien et al. For the SRQR. And this is basically just pulling out every bullet that we showed in the gray box and to showing you that all of a sudden, using this checklist, we have a nice paragraph where one might you might be able to see and read this and say, this is something that is tangible. It's something that is practical. You can see a project like this work in real time. And that this is just an example of what this might look like. This is just the essentially a shortened version of their method section. And so we're here to essentially discuss how you might utilize the SRQR or using these standards for reporting qualitative research. We encourage you to use it in all phases of your research. You might see the benefit of utilizing it as part of the development of your research studies, to documenting what is occurring in real time, how your project might be shifting, making sure that you have all the elements at play. And often Janine and I actually use it on how to write a manuscript so that we make sure that these important pieces of information are there so that a reviewer can adequately respond to the quality and integrity of our research studies. So we encourage you to use this as a checklist, essentially, to identify what's the most important, what's important for your specific study needs and how it's answering your research question. You know, you might have a wonderful study and you identify that the way that you're collecting your data, for example, isn't actually answering that research question, but it's answering something else. So you might therefore use this as a way to identify how do you focus in on answering the actual research question. And then on the converse, it also helps you determine what elements are missing. What are some ways that you can enhance your study and to ensure that you have answers in terms of how you are progressing in your research study and design. And finally, we just want to discuss how you might appreciate how these elements, whether or not they're incorporated, might provide a more complete information about this overall qualitative research design process. Essentially, we're encouraging everyone to increase their transparency of how they design and complete qualitative research processes, because well-crafted qualitative research, the more often that we have that, the more often that we write about it, it basically broadly enhances this trustworthiness and it elevates all other qualitative research overall. And then Dr. Nasr, I believe.
That was a lot of information. How we doing? Okay, so we have some fabulous resources for you. This was a lot of information. Don't be overwhelmed. It can be very simplistic, and to try to get a qualitative scholar to help guide you through this writing is really recommended. So some resources we've put together for you. I'm doing it. No. Well, there you go. I won't use that. I'll just push that thing. So just as a summary, here is the beautiful SRQR that we presented today. This is the type of guide that you can have right next to you when you're designing your study. And when you're putting to get on the MCHRI application, you can go right through each one of these items to make sure that you've incorporated it into your grant. And I'll tell you, once we get, and I know there's some of you possibly that are in our audience today that are reviewers. And when you're a reviewer for MCHRI for these grants, we also hope that you will use these same tips as you review the grants that come in that are qualitative, and to educate not only our applicants, but also our reviewers. To look at it simplistically is just to remember that it's broken up into 4 groups: title and abstract, pretty straightforward, the introduction, the method sections, and the implications. You'll be more focused on the methods from about number 5 to maybe 15 when you're writing your grant, all right? And we've given you examples. Next. We've added the list of references. You have the SRQR in your handout. We also have it in the folder that we sent to you when you registered for the course. We have the example qualitative article, the Kirkpatrick article that we use that you can reference. And then we also have some books that could be of assistance to you that are in the Lane Library for your support. Next slide. Oh gosh, sorry, I keep saying this, but I should do it. And then here are some references. We didn't have a chance to really dive into different types of methods, qualitative methods, which is really my heart and soul. And we've listed just a few articles that could help you if you decide to do a phenomenological study or an ethnographic study. There is lots of resources for you. These are just a few that you can pull up from the Lane Library as well. Next slide. So we want to open it up to questions and discussion. Before doing so, I just wanted to run through really quickly the handouts that you have, and those of you that they have these same handouts. You'll notice that you have both the original article, the Kirkpatrick article. You have the SRQR for your reference. What I really thought was great that is included also is the summary of the lecture today is all in this one handout that really shows you the bullets and the tips and the examples that we shared with you that you can use as a reference. We also have the SRQR just all printed out for you. That was very, and it's, yes, and it has, oh, that's right. This is so nice. So we have little check boxes that once you have this right next to you when you're writing your grant, and you can just check off each item as you go through it. I also really like the interview guide that we've included. You can't forget in your qualitative research grant proposal to include whatever interview guide you're going to be using, because your interview guide is really how you answer your research question and what kind of data you're really looking for. This has to be well articulated in your grant proposal as an interview guide. And this is an excellent example. It tells you, it gives you the topics on the left, and then it gives you key questions as well as prompts. Again, when you interview, it's very dynamic. It can be very iterative, and you won't know exactly. Your prompts can be varied, but this is an excellent resource for you to look at when you're designing your own interview guide. Okay, so insights from your own work or any questions that you'd like to share.
Yeah. You mentioned that it was like between 12 to 15 participants. I guess that was for interviews, but how many focus groups will be like a good number?
I think it depends on the groups and how much heterogeneity, there might be across the participants. So thinking about, again, your research question and who it is that are going to be your sampling units. You know, are they going to be teachers in a school? Are they going to be administrators? Are they going to be students? Because those are three distinct groups. And so you might want to think about what a good sample size is for a focus group, which can be, you know, anywhere from 5 all the way up to 10. I tend to think that a little on the high side, you don't really get as rich of a conversation. However, the literature does go up as high as, you know, 10 to 12 participants. I tend to like to be a little bit in that more medium range. But again, thinking about, you know, what's reasonable, how many people you might want to have in each group. So maybe you want to do 2 focus groups with teachers, 1 with administrators, because it's a smaller subset, and then maybe 2 with parents or whatnot. That would allow you to do some comparisons across the different groups. And if you were doing interviews, one thing we try to suggest is if you want to make comparisons across the groups and say, for example, teachers were most likely to mention this barrier compared to administrators, for example. If you're doing interviews, you want to make sure that you have a sufficient number of teachers and administrators. So going back to the literature, I would want, Sylvia and I, and probably Annette would want to see that maybe you have at least 12 in each of those groups. So 12 interviewed teachers, 12 interviewed, what was I saying, parents? Yeah, or administrators.
Another question about that, sorry. Like if the focus groups, like for example, you have 1 in English, 1 in Spanish, will that be like, you have to like, how do you like do that? Because at the end you can
Yeah.
end up having like a lot of focus groups, and I don't
I'm
know
s-
if it's like way too much.
Yes, I'm so glad you asked this question because there was one thing 2 points I want to make. One is the idea, and Janine mentioned this briefly, but I think it's also important when you're doing interviews. I'm going to come back to your focus groups in 1 second. Is when you are doing interviews, one of the terms that we do use in qualitative research to know how many people you need, it might be just 12 or 15 interviews, but one of the things we use is when you reach what's called saturation. And that's a really important concept in qualitative research because you are doing analysis all the time when you're collecting your data from your interviews. And when you start seeing that your cohort of participants are starting to say the same thing, you have reached what we call saturation. And that's something else that's nice to include in your proposal. Say, we will continue interviews until we reach what we call a point of saturation. So I don't want to get too much into detail with that, but I wanted just to give that point. Your question about focus group is a really good one. And I wanted to, we do have a moment here to insights from our own work, and I'll make it quick, is I was part of a multidisciplinary group of researchers. We looked at medically complex kids at the Children's Hospital, and we ran focus groups, and we ran with parents who are parents of medically fragile and complex patients and their discharge regime, especially with medications and discharge medications, to be specific. But we had an English focus group and we had a Spanish focus group, which was fantastic because we got different perspectives from both. And we found that you can only do so many. And I think we did 2 of each. I think we did 2 of each, 2 Spanish, 2 English. And we had a Spanish facilitator, Spanish speaking facilitator, and we had all the interviews translated. So all the focus groups translated. So I think it's really important to be inclusive when you're thinking of your focus groups, and especially somewhere like Stanford Children's, where we have such a diverse group of patients. Does that answer your question a little bit? So I encourage bilingual if you have the finances to do that.
Thank you.
Yes, you're welcome. Sorry, I
Yeah.
just wanted to add that.
Oh, I wanted to add a little bit to that as well. I mean, I fully commend anybody who is interested in looking at getting perspectives from participants of different language groups. Annette, that's wonderful to be able to expand on that. It is something that to consider about in terms of your resources and finances, right? There might be a cost in terms of finding somebody who is bilingual or can do focus group moderation. And also there is an extra cost usually from the translation to the transcription services. So be sure to incorporate that in your budgets as you're thinking that through. It's also important to potentially have somebody on your research team, not potentially, it is important to have someone on your research team who is native speaker or competent in the language that is data being collected, to make sure that you're capturing things that are not necessarily translatable, like in terms of phrases, etc. So you're getting a different sense of the essence of what's going on as well. That was my comment.
On resources is that you may not be able to hire, a bilingual translator to run your focus group. It may be more internal, but you want to think about the power differentials and any potential bias that could arise between who's doing the interviewing and who's being interviewed. So just thinking about that and adding that as your resource if you're going to do something that's bilingual.
Does that answer your question? That was a long answer to a short question.
Other questions, Sylvia? Are you seeing anything in the chat that you want to highlight?
No, just supportive chat comments.
We'll have 2, that's all.
Okay. So the first question was just about the trade-offs for generalizability, right, with qualitative research, and if you could talk a little bit about that. And then the second question is about how working with community partners can actually enhance this work even further.
Sylvia, do you want to take the generalizability question? I'll do the community partnerships one.
Yeah, that'd be great. I think that when we're looking at the type of research questions that qualitative research methods tends to be able to answer, they don't tend to be questions that are indicative of generalizability of entire populations. And usually we're looking at how people in a particular setting, in a particular context, are feeling or doing or processing or working in that kind of an environment. And so it's acceptable within qualitative research methodology to not be able to generalize out, particularly if we're doing something that is, smaller qualitative research studies. Of course, there's some mixed methods that includes qualitative studies that are very large and multi-million-dollar studies that, eventually you could say are generalizable just because of the type of data that are collected and the large population. But when we're writing up qualitative research, we acknowledge that it's not generalizable. However, there are ways to suggest that one person's experience, others, you could potentially conceive that others are also having a similar experience. So we call, actually Patton, who is a sampling guru in evaluation research, calls that something like that, logical generalizability. Like it's not a leap to say that one hospital, let's say, is, back in the day, remember when all the Stanford hospitals incorporated Epic into their system and the general headaches that they went through and concerns as well. Other hospital systems, might have similar struggles, right? So you could say to yourself, this one case study, others might learn from that as well, if that makes sense overall. And so just in summary, when we're writing up the research, we don't need to apologize for it to be lacking in generalizability. Acknowledging that this is what this population is experiencing is usually the direction that we take.
All right, so to answer Anisha's second question about how to do community engaged research that involves community partners, I think when you're thinking about the entire start to finish in the design, implementation, and dissemination of a qualitative project, or actually any research project, there are so many ways to get your community partners involved. I think the most important thing, and Anisha would agree, is making sure that the questions that are being asked have relevance. So those research questions have relevance to the community, because I'm imagining if you're doing a community engaged research study that you want to have that relevance to their own systems, their policies, their needs, their solutions. But working with community partners are going to have various levels of time, resources, and there's going to be a lot of different ways that they want or can't be involved in the research study. And I think to be thoughtful is making sure that throughout the entire process, you give them opportunities to provide input on that interview or focus group guide, to inform how the data are collected and how participants are recruited. They know the participants so much better than you do. In the data collection strategies, making sure that it's something that's really applicable and feasible for parents. The analysis of the data, in the slide about trustworthiness, Sylvia talked about the importance of having participant validation and getting to make sure that, one of the great purposes of qualitative research is to bring the voice of your participants, of your stakeholders to light. And in doing that, sometimes we'll get it right. There's so much that's subjective in qualitative research, but there's so many opportunities to make sure that we're being faithful to what our participants want to say. And then I know one of the things Anisha is a huge champion of is dissemination, is working closely with partners to disseminate those findings back to the community in whatever venue or method they see fit. That just to give you a very quick example, there's a really fabulous researcher here, Stephanie Smith, who has been doing really great work with farm workers and a farm worker organization. Oh, excuse me, not farm workers, the Latinx community in Salinas. She has done such a thoughtful qualitative research project to really hear the needs of cancer survivors as they kind of transition into adulthood. But she actually has just written up her first phase of data collection and had asked me to just look at it. It was lovely. And as I'm reading through, she incorporated so many details of community engagement, so many details about the methods and the approach. And when I got down to the bottom, I saw that she had referenced using the SRQR. And I was like, oh my gosh, it was like perfect. So sorry, I probably talked too long. Yeah.
Any other questions? Anyone from any chats? We're good? Oh, but those must all be. You mentioned what you said about that.
We had a question, and I'd like to maybe hear Annette's thought on this as well, about including data collection instruments as part of the grant proposal, even if it's not requested in the grant proposal. And my answer on the chat is, it's nice to show that it's there, to show that how far along your thinking is in terms of the research development and the methodology, et cetera. And it's also a way to gain feedback as well through that review process. But Annette, I'd love to hear your thoughts.
Sure. When I'm reviewing as a CE grant review and the qualitative study, I really appreciate any sort of instruments that are included in the packet to give us an idea as reviewers what exactly you're going to be using to answer your research question. Because that interview guide, to me, is one of the most important things in your design, is that you're asking your participants the questions that's going to best answer your research question and giving you the data that's going to best relate back to your research question. And again, it's all about how you design your study is all about answering that research question and always bringing it back to the research question. So I would encourage instruments, Sylvia, if that answers the question. Yeah. And I think we had a question from our audience, Dr.
Yeah.
Kim Pike-Grimm. Nice to have you here.
Sure. Thank you very much for this lecture. It was great. I'm Kim Pike-Grimm. I'm a nurse scientist in the Department of Nursing Research and Evidence-Based Practice, and do conduct qualitative research as well. I just wanted to comment just really quickly on the question that came up about generalizability. I have not ever heard that term, logical generalizability. I like that. But what I wanted to mention also is that I think one of the big outcomes or potential applications of work too can be that it's hypothesis generating. So that's one of the benefits of doing this kind of work, as well as it can lead to further work that can help to generate hypothesis for future, even quantitative work down the road. So just wanted to add my 2 cents on that.
That's great. Thank you, Kim.
Sure.
Really good point. Yeah. Any other comments, questions? Oh, yes, thank you. So what we'd like to hear from all of you is, this is the first of hopefully a few additional seminars focused on qualitative research. And we'd like to know from all of you, what topics would you like to hear from us in future qualitative sessions? And that could be more methods or more analysis, or wanting to having a seminar on how to write an interview guide. I mean, just anything. But are there any suggestions? Because we'd really like to continue this and to foster and to continue to educate and spur more qualitative studies at Stanford Children's. Questions or comments or ideas on what we could bring back for another seminar?
Different types of qualitative methods, and when you would decide to choose one over the other, right? Like interview versus focus group versus observation versus, combining them, that would
So
be.
you're saying methods of, when I think methods, I think, okay, phenomenology, ethnography, or are you saying, I want to hear more about methods of data collection?
Yeah.
Methods of data collection are observations, interviews.
Exactly.
All right. Someone's or taking notes of this, right? Are we? Yeah. So that would be a great topic, Anisha. I like that a lot. Really talking about how do you conduct how would you do observations? There's a lot of different ways to do them. How do you conduct an interview? I mean, there's a whole course, and Kim and I, we both have, and all of us have our PhDs, but Kim and I know I can speak to UCSF. We had a whole course on how to write an interview, how to do an interview, right? So how to write an interview guide, how do you conduct and develop probing questions? So I like that idea. Anybody else?
We have a one from the chat on
Yes.
successfully working with community advisory boards.
Yeah, nice.
Definitely.
Yep, community of the question from the chat, if you didn't all hear, is maybe incorporating some seminars on community advisory boards. I like that a lot. Good. I think this idea of community advisory boards is so important, especially for the SURF grants, and really pulling together a multidisciplinary group of individuals in the community that are diverse, and how do you conduct an interview or observation with that type of cohort?
And utilize them as outreach. And able to utilize them as outreach into the community, use them as your participant or member checking in terms of, is this what your community is seeing? There's so many potential ways to.
That's a great idea. Yeah.
You can also use them as an example internally. I really don't conduct any of my qualitative studies without running the interview guide, for instance, by the Family Advisory Council in the Bass Center. If I'm doing a symptom study or something, I get them to look at the questions and to review them from their perspective. So I think that they're just a valuable resource, even just internally what we have, and tapping into them.
Research
Great.
partners. I love it. And you're
Exactly.
pilot testing your interview guide.
And I actually have usually, like on one of my studies right now, which is a grounded theory study, have a parent on the research team.
Yeah, that's awesome.
Incredible.
Yeah. Kids could be part of that too. Adolescents could be part of that.
Use the AYA. It's an advisory council to review my AYA interview guides when I conduct my AYA research as well.
Yeah.
So I really use them a lot, and they love it. I've put them on panels to really fine tune things with other health disciplines. So, and they love that kind of work.
Yeah, that's a great point. So thank you.
Close things down, or?
All right. I think we've had some great questions. This is great dialogue. Thank you for the ideas for next seminars. We love it. And you'll be hearing back from us regarding our next Caesars. Yes. If you have any additional ideas that weren't shared today, please feel free to reach out to Mary Chen or to any of us in sharing your ideas. We're open to hearing from all of you. So thank you so much. And I want to give a special thanks to MCHRI and all of our support, Kim Stern. I just met you, Jessica, and I want to thank especially Sylvia and Janine. It's been a real pleasure working with you. And thank you, our Executive Director of MCHRI, Mary Chen. Thanks so much.